intimacy and relationships are extremely important to what makes people happy.
There is very good evidence that women are quite interested in sexual activity after they're 60, and many are sexually active.
Have the attitude about, I'm not letting go of this. And that also means taking charge of your physical self in a whole way.
Most men just want to know, well, if I have prostate cancer, can you find it? Can you treat it? Am I going to live any longer? If it's there, get it out.
The really good news is that obesity, frailty, and a lot of disease are not normal aging. That may be the cultural norm, but it's not written in stone.
Hello, I'm Ron Reagan. Everything about aging is changing. Research is filled with new information about how to age and who does it well. But even if 60 is the new 40, as many would like to believe, growing older still presents some undeniable challenges. Menopause and its male counterpart, Andropause, are the physical segues of aging, impacting sexual function and lifestyle. Yet seniors are healthier than ever with clear enthusiasm for a continued active sex life. With medical advances broadcast daily, what applies to the baby boomers' sexuality? Can this new generation of older adults maximize their sexual selves while minimizing the inevitable physical realities?
There's more to talk about. There's more to support each other in. There's more reassurances necessary because there's things that each person is noticing is not as automatic and not as culturally beautiful perhaps as it was before. Might take her longer to have an orgasm. It might take him longer to have an orgasm. They might not have orgasms and it doesn't mean anything. He might need help getting excited. She might need to be having more foreplay. All of this stuff is just change. It's part of the normal aging process, but we have so many ways now to sort of cheat that aging process and still enjoy our sexuality a lot, but only if we can acknowledge it and deal with it and talk about it.
There's a combination of factors, I think, that have to do with sexuality and aging. Some of it is just a myth that people aren't sexual over a certain age, and in fact, we know that's not true. And once people know that, they can change their expectations. And the physical parts of intimacy have to do with lubrication and adequacy of an erection and just really mechanical things that people have come to expect as part of the sex act.
I think that sexual health is an important part of health. And for those people who wish to be sexually active, I think it's an important part of life.
Often women who are in heterosexual relationships may see that their sexual activity changes, often as a function of their partner's ability to be sexually active.
I'm so lucky to be married to you. I've told you so many times that.
As you get up into the 50s, 60s, 70s, and 80s, you have tremendous variation in the rate with which people develop these changes.
I'm lucky to have a foxy wife for 55 years.
But the changes do occur, and they're usually a gradual reduction in the desire and the performance that goes along with sexuality.
About 50% of sexual difficulties are caused by the physical and psychological symptoms of a medical condition, such as absent or low sexual desire, painful intercourse or penetration, difficulties with erection or ejaculation, inability to have an orgasm, problems associated with postmenopause, such as vaginal dryness, problems associated with an illness, accident, or medical treatment. Medical conditions play a role in the way aging affects sexuality. For men, the prostate begins to become a focus for a number of reasons. Hormonal changes, menopause in women, and andropause in men can cause physiological and psychological changes.
Good morning, Robert. We began to realize that there's a condition called andropause, where men begin to experience changes primarily involving their hormonal milieu, testosterone, and the reproductive organs, the prostate, the penis, and the testicles.
So if you take a testosterone level on a guy who's 20 and you measure it again when he's maybe 50 or 60 and you measure when he's 80, the level will be lower the older he gets.
But I mean, I'm not getting any sleep at night now.
How often are you getting up?
Oh, about every 2 hours I have to get up.
As we grow older, obviously we all change, and the prostate gland tends to change as well. So the two main things are prostate cancer and the consequences of a, quote, enlarged prostate. The prostate gland is an organ that in a young male is about the size of a small plum. Sits just below the urinary bladder, and a channel called the urethra goes right through the middle of it, and that's how the urine gets out of the bladder and subsequently out of the body.
For a man to be conscious of prostate function, of sexual function, of erectile dysfunction is quite valuable as a person takes charge and plays an active role in their own aging.
As you age, it takes you longer to develop an erection than it did when you were 18. Firmness of the erection is not as good. Usually it takes longer to reach an orgasm. The orgasm is less intense, and there's a longer what we call refractory period before you can do it all again. The problem is that now the baby boomers are getting into middle age or maybe approaching old age, depending on how you want to measure old age. And the question is, well, is this the way it has to be? I think you have to decide, well, what's normal and how do you define normal? And does normal change with aging? Secondly, in order to have, quote, normal sexual function, close quote, you have to have certainly three things, and I think four, to have it work properly. It boils down to nerve supply, blood supply, hormone level, state of mind. And if you don't have all of those things at least reasonably intact, you are at some risk to have problems with one of those aspects of sexual function. But it's a big issue, and I think a lot of people didn't consider sexual dysfunction as a disease. Erectile dysfunction is actually a component of sexual dysfunction because there's more to having sex than just getting an erection. That's part of it. And to a degree, it's a function of aging. Just like when you're 60, you can't jump as high as you did when you were 20. Does that mean that you're ill? Not necessarily. It just may mean that you're 60 and the body changes. But I think that's now much more of an issue that men are willing to talk about. It's really hard to say, well, dear, let's talk about our sex life. So, I mean, I think that's probably one of the most difficult things to do, and probably one of the most important. That's something you can do something about. If men have concerns about prostate cancer, and most of us do at some level, then they really should go see their doctors about it.
My father's had, I mentioned this before to you, Doctor, but a couple of surgeries on his prostate, and so I think it's a concern for everybody, all the males in our family, that we look after our health in that regard.
It's been a concern in my family too, so we watch it very carefully.
Cancer issues, certainly sexual issues, are things that men don't, in general, easily go to see their doctors on their own for. Do you feel comfortable going in and talking to your physician about a sexual issue, for example?
I feel perfectly fine. I wouldn't have a problem at all speaking with my physician.
You know, you only have one time on this earth, and you just want to take good care of yourself.
Andropause and the decrease in testosterone has its signature symptoms that affect sexuality as we age. But menopause, the decrease in hormones estrogen and progesterone, is even more dramatic.
There are many changes that occur in a woman's body during the transition to menopause. It's probably a matter of 5 to 7 years, depending on how quickly a woman experiences this. And the changes not only involve changes in the menstrual cyclicity, in which a woman notices that she becomes more and more irregular with respect to how often she has her periods, but also women begin noticing some changes in how they feel. Some women experience a symptom called hot flashes, where suddenly they have a feeling of being very warm. Often it starts in the chest and rises up to the face. They may flush, their skin may appear more red at the time, and some women have a sweating that goes along with that symptom. What we have learned is that as women go through the menopausal transition, we are less able to tolerate changes in temperature. So we're less able to respond to the room temperature all of a sudden becoming hotter and hotter than we were able to respond at a younger age. And many women have learned to dress in layers as a way of dealing with this, because when you can't change the room temperature, you can change your body temperature by changing what you're wearing.
There are studies on the efficacy of a relaxation kind of yoga, restorative yoga, on the severity and intensity of hot flashes.
One set of investigators has looked at using a technique that is called paced respiration. So in other words, breathing in very slowly and deeply, and then exhaling very slowly and deeply.
Diaphragmatic breathing will slow your heart rate down. It triggers your parasympathetic nervous system, which tells your body, relax, chill out, and your muscles will relax. The functions of cellular repair and digestion start to work again.
So some women are learning to control their hot flashes simply by their breathing and using this breathing technique.
Breathing deeply is a really powerful tool to know how to do. And you can take it with you anywhere. It's literally right under your nose.
The pros and cons for using hormone therapy are complicated. Estrogen is probably the most effective medication that women can use for managing severe hot flashes. But at the same time, the Women's Health Initiative study revealed that women who use hormone therapy are at greater risk of heart disease than women who do not. The advice now to women is to use the lowest possible dose for the lowest period of time necessary to manage hot flashes. Many women wonder about using topical estrogens, particularly women who are having vaginal dryness and irritation, and some to the point where sexual activity for them, having vaginal intercourse, is just so uncomfortable it's not possible.
Vaginal dryness can vary from the inconvenient to the incredibly painful. Inconvenient is, you're not lubricating yourself. And a lot of women think, well, if I'm not lubricating, must mean I'm not excited. No, it means that your body is producing less fluid. That's all. You might be quite excited if you give it a chance. So what I have to encourage women to do is use a commercial estrogen.
For those women, using a topical estrogen preparation is often a very, very welcome source of relief. The dose of estrogen women are exposed to is smaller than if we were taking estrogen pills. For women who have a uterus, though, your healthcare professional might very well advise that you use a progestin to protect your endometrium from exposure to the estrogen product.
Other times, maybe you are estrogen sensitive in a negative way, or you just don't want to fool with that stuff. Use some of the commercial lubricants, and they're great. They're great. And you start slow and easy.
Another symptom some women experience with menopause is depression. Fortunately, exercise proves to be a strong antidote.
We do know that exercise often has a very important treatment outcome, and that's that it does enhance mood. It reduces the incidence and the severity of depression symptoms in some women. One of the things that we believe happens is that the beta endorphins in the brain are chemicals that are stimulated by exercise. So when people experience the runner's high, that's probably a biochemical response in the brain. And so this is probably the mechanism that is responsible for enhancing mood. And the more that we're learning about hot flashes, we're also learning that hot flashes are affected by some of the same chemicals. Serotonin is one example that also influences mood. So there may be a common pathway by which our biochemistry influences our mood and influences whether or not we have hot flashes.
The good news is, despite the changes that occur in menopause and andropause, men and women both benefit from practices that support strong physical and sexual health. A well-rounded exercise program includes endurance, strength, balance, and flexibility. Be sure to get at least 30 minutes of activity that makes you breathe hard on most or all days of the week.
To stay physically fit makes a huge difference in a person's ability to enjoy sex and to preserve normal testicular and prostate function.
There's no replacement for wonderful health habits throughout the lifespan. Certainly we know that exercising regularly, being physically active, and observing healthy nutritional practices is very important for many aspects of a woman's health.
If you're healthy, if you have a normal diet, if you exercise regularly, if you don't have already serious cardiovascular disease, then if you say, well, is there something I can do to kind of maintain this as I age? Well, yeah, graduate exercise and regular exercise is important in trying to hold what you got, so to speak.
Boomers and seniors are joining enthusiasts of all ages in practicing yoga. Yoga is an ideal option for strengthening and stretching, two of the most important parts of an exercise program, particularly as we grow older.
Right arm reaches.
Yoga has been around for centuries, and there are many different schools of yoga. And recently there was a study from our center which showed that yoga is as effective as almost anything we know of for the treatment of low back pain and for prevention of recurrence of low back pain. So the evidence base that something has been around for centuries is now quite solid.
Relaxed face, relaxed jaw. When we are faced with stress, our body clenches up, like our muscles get tight, our breathing changes, our pupils dilate, our palms get sweaty, and we're in a fight, what's called a fight or flight response. And that is great for jumping out of the way of an oncoming bus. But a lot of how we're living in our modern society is in this perpetual state, adrenaline state, stress state. And those are contributing factors to disease. So the way that yoga helps us handle stress is a big, big piece.
As a physician and a scientist, I read the research results and I was astounded by the difference that yoga made for the people that practiced it in this randomized trial we did at our center.
To protect your knees, make sure your knee tracks right over your ankle. So
I was interested in the physical nature of it, the social nature, and then I think there's something, at least in the class that we take, that has a spiritual side to it, which is very interesting to me, is that sort of how do you combine this mind, body, spirituality in a way that doesn't artificially separate the three.
when we're not moving, when we're not exercising, we lose muscle mass, we store fat more, our energy level goes down. In fact, fatigue builds on fatigue. If we're feeling tired and don't exercise, don't move, don't do what we can, we'll probably feel even more tired the next day. To live a long and healthy life, you need to eat right and exercise. I don't think anybody who's watching is going to say, you know, oh my God, yoga lady. You're so right. I never even thought of that. I will eat less and exercise more, you know. So we know what to do. The interesting thing is why don't we do it?
Another way to ensure that your yoga is safe is to be in a group that's like you. So if you're with a group of people who are 20-something and you're 50-something, you may be more likely to get into trouble than if you're in a group of 50-something-year-old men who are all like you.
Curl in the spine, be rounded.
And being in a group with others is really encouraging because you give each other that support and you each feel like you're making progress.
But you just come as you are, you know, and a good yoga teacher will say, yay, here you are. And okay, and I'm going to encourage you to go, you know, like this much further today.
Yoga, weight-bearing exercise, and consistent and safe aerobic workouts can make a dramatic difference in the physical well-being of seniors. What's the connection between a healthy body and sexual intimacy as we age?
You know, it's sort of like people say, I have a heart problem. Well, they also have a circulation problem. They may have stress. I mean, we have a holistic approach to the body now, and sexuality isn't in some little black box that, you know, we untie or we tie and then it doesn't relate to anything else. You know, of course, sexuality is part of our mood and part of our physical abilities, our overall health, our mental health. We're a package. It's all related.
And it's the people themselves and the way they feel about each other and the bonds they create with each other that makes the sexuality all that much more interesting and pleasurable.
It makes sense that if we're feeling good in our bodies, then we may feel more, frisky.
The intimacy does not have to occur solely by means of the traditional sexual intercourse, but can occur with all kinds of different methods of touching, and people discover this themselves and often don't have to be told. What they have to be told is that there's nothing about the way sex was for a younger person that necessarily has to be the way sex is for an older person. And once one kind of releases their inhibitions and allows that discovery to occur, things tend to work out well.
Touch and connection can make anybody be very luscious to somebody if the emotional connection's right.
Sex does not have to include intercourse. Understand the changes that aging brings to each partner. Try different positions. Try having sex at different times of the day. Don't hurry. Arousal may take longer as we age. Make your partner a high priority, listening to their needs.
I think all couples need dates. They really do. A lot of couples get in trouble because all they give each other is residual time. Not a date, but okay, the kids are in bed, the laundry's been done, I've balanced the checkbook, okay, now we have an hour.
The sexual issues that surround aging aren't limited to couples. There's an explosion of online dating activity in people over 50, and the numbers are growing. Add the complications of andropause and menopause to the perils of herpes, AIDS, and STDs, and the quest for love or romance can become a daunting enterprise.
There is a certain attenuation of lifespan statistics over 50, so people will be widowed. And for a lot of these people, if they weren't divorced early in life or they didn't lose a partner early in life, it's a huge shock to lose a life partner of 20, 30, 40 years duration. The fact is, if you've had a great partnership, it's hard not to want another one.
So find yourself somebody to love right now and now.
When you're dating, I think you have to have safety precautions at any age, which is to say, your first meeting, you meet in a public place, you do it in the middle of the day where you can get to your car safely. I mean, you just don't ever want to do anything private with someone you don't know. The other part is when you do get intimate with somebody, I think it's really important to realize that now condoms are absolutely necessary. And that's really hard because everybody over 50 grew up in a time where the big deal was pregnancy, maybe herpes, but not HIV.
Clearly, getting older, whether single, married, or with a partner, isn't anymore a futuristic or amusing topic of conversation for baby boomers. This significant portion of the population has the opportunity to take advantage of resources unknown by previous generations. Much of what will guide their aging process is the consciousness of the collective group.
Anti-war demonstrators protest U.S. involvement in the Vietnam War.
Baby boomers marched against war, developed a new brand of feminism, and created change in social awareness. Can they now embrace and accept their mortality? Maintaining an active sex life may depend on how seniors view the aging process itself. At 60, 70, and beyond, will they create a new formula for what it means to be old?
I can't catch you. Oh, try.
It's an activist approach to health. You don't expect somebody else to help you age. You're going to age because you help yourself age.
we all need a kind of vision of ourselves as vibrant, active people, so that as we age, we're getting the very best out of it that we can. We have these great minds that we can continue to use, and they'll stay great if we continue to use them. We can have great relationships if we continue to invigorate them. And so I think, to me, that's the art of aging, which is to do it the very best one can, as opposed to just sort of letting the fates take us where they will.
I think there is an art to living in general, and I've always believed that if we embrace aging as an opportunity to live differently and perhaps to live more fully, that there's much to look forward to as we age.
Funding for the Art of Aging was provided by the Development Fund of Group Health Center for Health Studies, a non-proprietary public interest research center devoted to transforming healthcare in the real world, and by University of Washington Health Sciences Administration. For more information or to purchase a copy of this program, visit www.artofaging.org.